Assalamu alaikum wa rahmatullah. The article of this week is titled Patient-Centered Outcome Assessment of Static and Dynamic Navigation Aided Endodontic Microsurgery, a randomized control trial. It was published in 2025 in the Journal of Endodontics by Chen et al. So, as the current evidence on the clinical outcomes of static navigation and dynamic navigation assisted endodontic microsurgery in vivo is relatively scarce, and there is no studies have directly compared these two guided approaches with a focus on patient-centered outcome measures within the first post-operative week. So the aim of this study is to evaluate the quality of life and analgesic use 1 week after surgery, as well as surgical duration associated with static navigation and dynamic navigation aided endodontic microsurgery. Moving on to the materials and methods, 60 patients were randomly assigned to the static navigation group or the dynamic navigation group, 30 patients for each. For their inclusion criteria, they included patients aged between 18 and 69 years, and also diagnosis of symptomatic or asymptomatic apical periodontitis in previously root canal treated teeth. After that, both groups underwent endodontic microsurgery based on a pre-surgical plan, where a tooth-supported 3D printed guide with metallic sleeves for the static navigation and optical tracking with infrared markers and real-time screen guidance for the dynamic navigation. The primary outcomes were patient-reported quality of life and analgesic use during the first week, while the secondary outcome was the duration of guided procedures, including osteotomy and root end resection. The quality of life was assessed using a visual analog scale-based questionnaire. The questionnaire evaluated symptoms like the pain, swelling, bleeding, and the functional impact like mouth opening, chewing, talking, sleeping, and daily routine, with average scores for each component calculated daily. For the results, there was no significant differences observed between the two groups in terms of age, sex, or tooth position. A significant difference was observed regarding the jaw type only, where the dynamic navigation group had more maxillary cases. The 1 week post-operative quality of life related to swelling peaked on the second day and gradually decreased over time, whereas other symptoms and functional impacts reached their peak on the first day and subsequently diminished. No significant differences were observed between the two groups in terms of pain, swelling, bleeding, mouth opening, chewing, talking, sleeping, or daily routines. Furthermore, there was no significant difference in analgesic use between the two groups. The operation duration for the two approaches differed significantly, where the static navigation is faster almost in 2 minutes versus almost 5 minutes for the other group. In conclusion, both groups enable minimally invasive endodontic microsurgery with equivalent patient-centered outcomes, though this static navigation demonstrates a significant advantage in reducing the duration of guided osteotomy and root end resection. These findings provide patient-centered reference metrics to guide to the selection between the two guided approaches in clinical practice. So, in my opinion, the jaw type distribution between the groups is potentially confounding the operative time comparisons due to the anatomical and accessibility differences. Also, the cost effectiveness of both approaches is an important measure that is related to the patient, which can make the patient decide which approach to choose.